Hello friends, today we are going to discuss about the colorectal cancer. The incidence of colon cancer is increasing day by day in the world. The reasons are very obvious. Change in the lifestyle, lack of physical activity, change in the fooding habit and the obesity. These are contributing mainly to the incidence of the colon cancer. But the few percentage of patients are having colon cancer running in the family. These may be the familial polyposis syndrome, non-hereditary polyposis syndrome. These also contribute to the etiology of colon cancer, but they are very few. So the things remain the same. The lack of physical, that is the change in the lifestyle, is the major contributor for the colon cancer. The symptoms for the colonic cancers are very subtle. Patient will have the anemia, which leads to the fatigue, weakness, lethargy. But we treat them as a nutritional anemia, but we should investigate them so that we doesn't miss the colon cancer. Patient will have blood in the stool and patient will think that this is piles and only piles. But we should always investigate them and rule out the colon cancer, because blood in the stool is not only from the piles or the fissure. It may be because of colon or the rectum cancer. Simple investigation of colonoscopy, which is the endoscopy which we put in the anus, can detect the cancer in the colon. And for further in radiological imaging, we need to do like the CT scan or the PET scan to see the spread of disease, how much extent the disease is. And with the early diagnosis or with the proper diagnosis of the colon cancer, we can go ahead for the surgery. So the surgery is the cornerstone for the treatment of the colon cancer. Surgery can be open surgery or the minimal invasive surgery. Nowadays, minimal invasive surgery like the laparoscopic surgery or the robotic surgery has come forward for the treatment of the colon cancer. Now the days of the long incisions of the open surgery has gone. Painful incision has gone. Now with the use of laparoscopic or the robotic surgery, we can perform the colon cancer surgery with the minimum blood loss, minimum pain, and early patient can go home and resume his duties. And the other treatments like the chemotherapy. Now the chemotherapy is also get advanced. Now the targeted therapy has come. Many techniques have come to reduce the side effects of the chemotherapy. In some patients may require the radiotherapy. So the early diagnosis with the early investigation. No, don't go only thinking that I am having piles or the nutritional anemia. Investigate them properly, diagnose them properly, diagnose them early, go for surgery, complete the chemotherapy, complete the whole protocol of the colon cancer surgery, and all these can give better survival for the patient. Even nowadays, colon cancer with the liver metastasis can also be operated with the better techniques. So the moral of this talk is change in the lifestyle, so that at least we can't prevent them, but at least we can delay the colon cancer. Thank you.